New Mexico Cancer Center and Health Specialist of New Mexico are the proud sponsor of health and wellness on New Mexico Living.
Today we're joined by Dr. Katherine Sanchez. She's a medical oncologist that specializes in breast cancer with the New Mexico Cancer Center and Health Specialist of New Mexico. Dr. Sanchez, thank you for being here today.
Oh, thank you for having me.
When we were briefly talking before this segment, you had mentioned your journey to me a little bit in the medical field. You went to medical school here, you left for further training, and you have now come back to New Mexico. Can you talk to me about why you chose to specialize in breast cancer and what brought you back here?
Well, I think many of us come back, and I hope that more of us do. I grew up here. I'm a native New Mexican, and I wanted to come back and serve the community that raised me. And I had to leave, and I think in order to complete my training and to really, I wanted to bring something back. So I did leave for about 8 years after medical school, just to specialize. And I always wanted to come back. And as soon as I thought I was ready and could bring something back, I did. And I think that in New Mexico, a lot of people have limited access. Mm-hmm. And when it comes to cancer treatments, I think there's even fewer resources for people here. And so I felt like it was particularly important to bring back clinical trials, because clinical trials have changed. The way we do medicine has changed, and having access to clinical trials is having access, I think, equal to standard of care in oncology. It's how we move the field forward. It's how we make progress. And so I felt like no one can afford to travel for their medical care. And I want people to have that access here.
Absolutely, removing some of those barriers, making sure people do have access to those resources. Doctor, how do you see clinical trial access changing here in New Mexico?
You know, the FDA has charged oncologists and drug companies and or research organizations with having minorities on clinical trials. They want clinical trials to reflect the population in the United States, which by 2050 will be a majority of minorities. And so I think it's a unique opportunity right now for us in New Mexico, because we are a minority majority state, that we are able to have access to more trials here and impact the way that medicine and cancer treatments will be in the future.
And hopefully giving people the confidence to know that here in their very own state, they have access to the healthcare resources that they need, that they're going to be able to find that help that they're looking for. One of the things you say you brought back when you came here was Women Care Wednesday. Can you talk to us about that?
Well, when I came back, I recognized that partially because of COVID, the support for people who were experiencing cancer or survivors of cancer had really fallen away. Mm. There are local organizations that are doing a lot, but people who were diagnosed with cancer during COVID experienced cancer alone for many of them. And so I reached out to our foundation to help support me in trying to start something for women that basically helps them in survivorship. And I think in general, we teach women generational self-neglect, and making the transition from treatment to survivorship is a really hard transition for most women. And so this is our way of teaching women self-care as a part of thriving in survivorship.
So when you talk about survivorship, you are talking about after the woman has made it through treatment and those next steps?
Either in the middle of treatment or people who've been treated previously. Okay. Either. I think having support during treatment and having support after treatment is something that makes the journey so much easier for women. Having the support, women in general, when they come together, I think thrive, and having that support from a group of women who've gone through something similar to you, I think makes a really big difference. And so we've done things like teaching weaving, and we teach nutrition classes. Those are free. And I think people feel like our medical care is lacking in terms of teaching nutrition and how to take care of yourself after a diagnosis. And so this is our way of trying to help bridge that gap.
Well, beautiful. Doctor, who can attend Women Care Wednesday?
Anybody. You don't have to be a patient of our practice. In Gallup, we have people who were treated, other places or have finished their treatment, and they are welcome and come often. And even in Albuquerque, we work together with other organizations who are already doing this work, and partner with them. And so other people from the community who are not treated at our practice do come, and we welcome anybody.
Again, giving that access to everybody so they have those resources, which is amazing. Where are the Women Care Wednesdays located? Where can we find you guys?
Yeah, so in Albuquerque, we have them the first 3 Wednesdays of the month currently. And right now, those oftentimes are centered around nutrition and teaching nutrition as a part of wellness. And those are around lunchtime, basically, on Wednesdays. And then in Gallup, we are there every week. And those are basically between 11 and 2. And we have similar resources, but because the communities have different needs, they are different. But they happen both in Albuquerque and in Gallup.
Beautiful. So 2 big cities that you guys are servicing. Do you have a website that we can go to for more information on everything we talked about today?
Yeah, so we have our New Mexico Cancer Center website, and our foundation website also has information. We also have a social media page that does have some of our information posted.
Beautiful. So 2 good places we can go to for all that information. Dr. Katherine Sanchez, New Mexico is lucky to have you back. Thank you for your time today.
Thank you for having me.